Hello, my name is Amanda Ferrand. My presentation topic is on the importance of attachment among children. Attachment is an emotional bond shared between two individuals. This bond becomes very important for children to develop in infancy, as this attachment affects the physical, emotional, and social development of children. Children can develop a secure or insecure attachment with their caregivers, which are categorized by the reactions shown when in situations of distress and happiness. Secure attachment is found among children who have trust in their caregivers to fulfill their needs. Some of the characteristics found in children with secure attachment are that the children show trust, empathy, excitement to learn, are able to show happiness upon the arrival of their caregiver, and show signs of distress when the caregiver have left them. However, a key component of the secure attachment is that the child is able to soothe after the caregiver has left and show signs of a happy individual. Insecure attachment is found mainly in children who do not receive adequate care within the first few years of life. There are three subtypes of insecure attachment. They include ambivalent, avoidant, and disorganized attachment. Ambivalent attachment is an uncommon type of insecure attachment among children, and is shown when the child shows extreme distress when leaving the caregiver, which is caused by a lack of maternal availability. Avoidant attachment is most commonly found among children who are abused or neglected by their caregiver. These children show no preferences when having to choose if they would rather leave with a stranger or their caregiver. Lastly, disorganized attachment is found among children who seemed confused. Parents can cause both a source of fear and comfort to their children, which is caused by the erratic behavior shown by their caregivers. Many studies have led to the conclusion that children with insecure attachments have more difficulty showing signs of attachment to partners and therefore show signs of insecure attachments to their own children, as the attachment that children have with their caregivers affect their entire lives. Secure toddler and preschool children are more likely to attempt new activities with the intention of knowing they will succeed. However, insecure children are more likely to avoid the new situations. Studies have also found that attachment has a great effect on social competencies of the individual. They are more likely to be socially confident and academically inclined as they have more self-confidence. The stages of attachment are developed at different ages. According to Rudolf Schaffer and Peggy Emerson, who studied over 60 infants for the first year of their lives, have come to the conclusion that there are 4 stages of attachment within the first year of life. The first stage begins from birth to approximately 3 months. They refer to this stage as the pre-attachment stage. They have found that the infants do not show attachment to any specific caregiver. The second stage of attachment is indiscriminate attachment. They found that children from approximately 6 weeks to 7 months is when they begin to show signs of preference among caregivers. However, they will still willingly accept care from any caregiver, but react more positively to the familiar faces. The third stage of attachment they found was known as the discriminant attachment. This stage begins from approximately 7 to 11 months. Infants begin to slowly show preferences to a single individual and begin to show signs of stranger anxiety and separation anxiety. Lastly, the fourth and final stage is known as multiple attachments. This begins around 9 months and continues throughout life. This is when the infant begins to show signs of attachments to other family members, including the grandparents, older siblings, and the father. However, insecure attachments affect all the stages, as some children will never fully complete the stages to have a secure attachment. This will affect their physical, emotional, and social development. As attachment has to be a bond between two individuals, an unwilling caregiver will affect the children's whole aspect of life.